I'd like to welcome everyone to this session, which is a training session to learn how to assess digital ulcers and scleroderma. My name is Murray Barron. I'm the Chief of Rheumatology at the Jewish General Hospital at McGill University and the Director of the Canadian Scleroderma Research Group. And I'd like to go around the room and have everyone introduce. I've seen patients with scleroderma for 30 years. So I'd like to go around the room and just have everyone introduce themselves, tell us where you're from, your name, and how long you've been seeing scleroderma patients, just so that the people that listen and watch the video will have some idea about who we are.
Janet Pope, rheumatologist at the University of Western Ontario in London, Canada. And after my fellowship, I got interested in scleroderma. So since about 91, 93, and there I've been seeing scleroderma patients.
I'm Geneviève Gigé, so I did my training, a fellowship in scleroderma here at the GGH, and I did a special specialization in video capillaroscopy with the video cap. And I did see scleroderma patients since 2 years.
Good morning, Dinesh Khanna. I'm at University of Michigan. I'm a rheumatologist and I've been seeing scleroderma patients for the last 5 years.
I'm Amisha at Johns Hopkins University and I've been seeing scleroderma patients for 5 years.
I'm Marie Hudson. I'm a rheumatologist at McGill University. I'm also part of the Canadian Scleroderma Research Group, and I've been seeing patients for, I'd say, 5 years.
I'm Laura Hummers from Johns Hopkins University. I'm a rheumatologist, and I've been seeing scleroderma patients for 8 years.
I'm Maureen Mays from the University of Texas in Houston, and I've been seeing scleroderma patients since 1981, which puts me at 31 years.
I'm Virginia Steve from Georgetown University, but I'll just stick about 30 years.
I'm Lori Chung from Stanford University, and I've been focusing on scleroderma since my fellowship since 2003.
Okay, thank you everyone. So we're going to go through a set of slides and discuss how we want to assess ulcers. At the end, we're going to talk a little bit about measurement of ulcers also, which may turn out to be a separate video, as it may not turn out to be very useful. So the background here is that there was a published study in arthritis and rheumatism by Arian Herrick and a large group with Chris Denton, where via the web, a reliability study had been done to determine our abilities to detect whether an ulcer is active, inactive, or indeterminate. And I've used photos from that study, actually, and I'd like to thank Arian, in fact, for having contributed that sort of set of photos to us. I'm going to go through some of the photos with you. We're going to discuss the terminology that's been used in her study, and that's used in digital ulcer treatment trials. And then look at the photos that were controversial and on which there was actually very poor agreement, and that's many of the photos actually, which do not have a lot of agreement, okay? So in her photos, you'll see a little disc, and this disc is just to measure the, give you a baseline for the size, and the discs are 6.4 millimeters in diameter. Okay, so in her particular study, which was done with 35 photos seen by each rheumatologist twice, the participants were asked to grade the images on a 3-point ordinal scale. And the terminology was no ulcer or ulcer. And if there was an ulcer, they had to determine if it was inactive or active. All right? Most digital ulcer studies define digital ulcers as an area with visually discernible depth and a loss of continuity of epithelial coverage, which could be denuded or covered by a scab or necrotic tissue. If denudation is not clearly visible, loss of epithelialization, epidermis, and dermis are to be determined by the investigator. And that's an important issue here. So the studies leave it to the investigator to determine if they can't see the base of the ulcer, whether there is an active ulcer there or not. If the area is denuded and it's very clear, the ulcer is meant to be pronounced as an active ulcer. So what's an indeterminate ulcer? And there have been variable definitions in trials of what an indeterminate ulcer was. one definition is if denudation cannot be judged because of the presence of a scab or necrotic tissue, the ulcer will be pronounced indeterminate. Another study had a slightly different definition and said that an ulcer with indeterminate status lies between a current active digital ulcer by definition and a completely healed ulcer. So these are really not exactly the same concepts, all right? A completely healed ulcer is an ulcer that's considered to be completely healed when total reepithelialization of the ulcer is observed.
Can I make a comment here,
Yes.
though? If you have a necrotic area, would that not be active? Like whether I can, just as a comment, necrosis, that is not indeterminate, in my mind.
It's saying that you
I might not
that,
be
that
able
you
to know
can't
the
see
depth.
the actual
Right.
base of the ulcer.
But that doesn't
Because it-
matter, I can
when
still
the-
say it's active, I just maybe can't tell you how
When
deep it
those
is.
necrotic scabs come off, they can be totally epithelialized underneath. So you can't see what's underneath.
But if
Yeah.
it fell off today, it wouldn't be, if it fell off in 3, you know what I mean? It's a few weeks hence maybe, but I guess
But you
we
don't know when
the
it's gonna
timeframe.
fall, right.
You don't know when it's
So,
going to fall.
but you know that underneath those scabs, you can have a totally epithelialized.
or
ulcer.
or
That's
you
their
might
defi-
have an active ulcer.
No, that's what I'm saying,
Right.
that's
So you just
the
can't
reason
tell.
why they did that.
Yeah, but the way a scab falls off is because the epithelialization
under.
occurs
Healed.
under,
Yeah.
yeah, underneath
Pushes
and
it
lifts
off.
it
Yeah,
off,
it lifts it
Yes.
off eventually.
so that if it looks like the scab is adherent to the underlying tissue, that, you know, I agree, that
I would call it
implies
active and not
that it's
indeterminate.
active, but I'll go with the decision of the group.
Okay, so we're going to come back to that, okay? So this is a comparison then, a summary of the different terminologies from Herrick's reliability study and most of the digital ulcer treatment studies, right? So no ulcer, everyone agrees on. In Herrick's reliability study, they did not use the term indeterminate. She used active ulcer or inactive ulcer, and the treatment studies use the term healed ulcer, all right? So they're all slightly different. And I think in the end, one of the goals here is to decide what terminology and what definitions we should use for treatment trials. And that in a reliability study, we should use the same terminology, all right? Okay, so indeterminate, as I said, is either you cannot judge or you decide it's between an active and a healed ulcer. If it's between an active and a healed ulcer, the truth is it's an active ulcer, as it's not completely healed. So that terminology doesn't really carry much weight to me. You're really just sort of you're saying in another way that it's an active ulcer. You can't be a little bit pregnant. So you're either active or you're healed or you can't tell, all right? So I think that the best definition for indeterminate, which I think is a reasonable thing to use, is that you can't tell yet in your own mind if you feel that it's active or not. And that's what I would propose that we use as a definition. In other words, you cannot judge. So let's have a discussion about that.
Can I make a comment? Because it's one thing to define it, and you put up a nice definition up there, and sometimes from that you can't tell based on the definition. But you know, sometimes if you palpate the ulcer, you ask the patient, is that painful? With the same definition, if the patient says, no, it's not painful, then it tends to lead me towards one conclusion,
Right.
whereas if it's painful, it leads me the other way. So can we incorporate something like
Yes.
that into the definition?
Well, we're going to talk about pain, but it's possible we could decide to include pain in some of the definitions here.
Yeah,
And pain would be the
Pain.
patient-reported outcome, though.
yeah.
Because to be quite honest, I've never thought of pain to push
Help
me
you.
one way or another.
Yeah.
Because if it's really painful, maybe it might be location or it's severity. But sometimes is it infected or there's still really heat,
Yeah.
whatever.
But there are, as any sore heals, even after it's healed, there's still some residual tenderness. So I hesitate to say that. And some people with the tender digital pits, they'll say, yeah, that's tender, but you look at it, it's not open. It's not an ulcer.
I think I agree with you, but from a multi-center study and international study, the more objective we are, the better it will be. And I think one of the reasons treprostinil study was negative in my mind was a change in inclusion criterion in the middle of the study that included a scab with some pain or redness and things like that, and that becomes very subjective. You know, how much pressure you have to put, where is the tenderness around. I like your idea that keep it very simple dichotomy. Either there is loss of epithelialization or there is a epithelialization, and in the middle we cannot judge what it is. And in my mind, that's what indeterminate is, and that probably has a big impact on how the analyses and what the results are of the study.
Okay, but you have to remember that indeterminate also, I mean, all these are subjective. They're up to the doctor who's looking at the ulcer at the time, you know? I personally, in my practice, use pain to help me decide if something is an active ulcer or not. I agree that some of the pits are tender and painful, but they're tiny little pits. You can't even see anything there. So
And I
then
would
it's not,
not
so
call
the
that-
question doesn't come up usually, you know? The question usually comes up when you're not sure, is it an active ulcer or not? And then I sort of press it, and if the patient tells me it's painful, I say, well, yeah, this is probably an active ulcer.
Probably, right? So you said probably an active ulcer. For a multi-center study, again, the more objective you are, the outcome, more clear an outcome measure is, the better it will perform. You know, the probably an active, really in even your mind, brings that issue whether it is or not. We want to be clear cut.
I think the definitions that have been used actually state painful but ischemic in nature, so patients should have pain without necessarily tenderness to palpation. I think that they'll complain, they know when it's still active and they can tell you. So that's kind of how I use pain subjectively. for
Me
the
too. I
patient.
use pain. I ask the patient, "Do you have pain?" But I do not press to see if they have pain. I just ask them, "Is it painful or not?" And if they say no, I say, "It's probably not active." And
There's a
they say
difference
yes.
between pain that's ischemic and active as we're defining it here, right? So you could have an ischemic lesion but not have loss of epithelialization yet. And we'd still say it's ischemic, but it wouldn't be an active ulcer per this definition. So I agree with Dinesh. I think we need to keep it clear to the, to make this clear to one strict definition of loss of epithelialization as an active ulcer. If you can't determine, then you can't determine.
You know, I agree with everybody. I treat people, and I agree with pain versus ischemia. In my practice, I would probably treat that person. But from a
Go for it.
multi-center standpoint and from a pharmacological therapy standpoint, we should keep it clear cut.
So that would be the conservative position, that if you can't decide that it's active by looking at it, then it's at least indeterminate, right? Or not an ulcer. I guess if you can't decide, it's indeterminate. Okay, so not an ulcer would be something that you could determine.
Okay, but what if something has loss of epithelialization and it's clearly calcinosis though? I mean,
Yeah, that's a different
right,
issue,
so
right,
we'll
but-
come to
right,
that,
but that is indeed loss of epithelialization.
Yes.
But
Right,
that would
but
never
that's
at this
still not
point
an ulcer.
go into a
Right.
treatment trial.
Okay,
because
so
it would be
we'll come to
excluded
that
as a
eventually, but what
primary
things are not ulcers? We'll
Right.
come back to that.
Right.
Or not the ulcers we're talking about.
That's right, not ulcers for
They
studies.
certainly
That's right.
ulcerate.
So is that the consensus here, that no one wants to use tenderness or elicitation of pain? I think that's the consensus. We don't want to use pain. That's important.
That's my, I think, bias.
My bias would have been the opposite, but if the consensus is against me, I'll go with that. Yeah.
Because the issue is going to be, you know, they clearly had an active ulcer there in the study. Is it healed or is it indeterminate? And if you look at it and think, oh, I think this is healed, epithelialized, but the patient said, boy, it still hurts. It's less painful, but it's still not totally pain-free. That's what's going to be the problem. Do you check indeterminate or do you check healed? And I think you
Because
ought-
I'd say healed from what you said because
Right.
you're epithelialized now.
Right, yes. And if you depend on patient reporting of pain or tenderness.
Because that could lag months behind in
Exactly.
treatment trial, right?
Yeah.
Weeks behind if it was
Yes.
a big ulcer, months.
And that
or-
is totally
And I'm-
captured
So
from
if we
the
use-
patient's
right.
standpoint.
Right,
Mhm.
right. They, their function and their pain will lag behind. The
Mhm.
same as, you know, other things sometimes we'll see improvement before they feel improvement, right?
Okay, so we're going to use indeterminate. without pain. Just means you can't decide whether that ulcer is healed or not. And if you have to make a decision if a lesion is an ulcer or not, you won't use pain to make that decision. Is that also true?
Yes, I
That's
think
also true.
So with the patient today, we should not ask them any questions.
Well, if that's the
That's right.
decision here,
Or
yes.
can we ask them, you know,
Sure.
how long do you have this, since when do you have this ulcer? If they say, maybe you think it's, let's say you think it's active, just by saying something, and they say, oh, this has been here since 1 year, it's not going to be active. Maybe you're wrong.
Okay.
At that time.
That's
So-
an interesting.
for the upcoming trials, for the upcoming drug therapies, the inclusion criterion was defined as within 8 weeks because we did not want to capture ulcers that are due to calcinosis or that have been standing, associated with pain and things like that for them to enter into the study. In my mind, when I look at this, either there's loss of epithelialization, which is inactive, there's epithelialization, which is healed, and then there are issues with necrosis and scab, which is indeterminate. It's a pretty simple, ordinal variable if you think about that. As soon as you bring pain into it and other issues into it, I think you muddle the picture.
And the duration of the ulcer to determine if an ulcer is an ulcer and active or not? Does that
Duration is an inclusion criterion.
But that's not in your definition of
But
whether
that's-
it's an
No.
ulcer.
So there could, because the long-standing are unlikely to heal in a fast manner.
Yeah,
that's right.
more, the chronic ulcer can still be chronic and active, just like someone can have other people. Ischemic leg ulcers that last a
Okay.
long, long time, right?
So you look at the ulcer to determine if it's active, but you don't ask how long the ulcer has been present to determine if it's active.
I think that's an important
Correct.
inclusion criteria.
Right.
That's
Right,
a different
separate-
issue.
separate
That's a
inclusion
separate
criteria.
issue.
Yeah,
So in the end, an ulcer is an ulcer, whether it's been there a long time or not, whether you want to put it in the study is a different issue. So,
Correct.
okay, so we don't ask that question about the ulcer
We
to
don't
determine
speak
if
the
it's,
patient.
well, yeah, probably that's right, okay? All right. All right. So an indeterminate ulcer is basically cannot judge whether it's active or healed. You're not sure. It's not between active or healed, right? That comes out. And if we use cannot judge, then in the study, an ulcer that is indeterminate at baseline or that appears during the study cannot be called an ulcer. Okay? So let's say you look at somebody today's baseline visit for the study and you look at a lesion on the hand. Remember that indeterminate was not that it's not an ulcer, is you can't determine if it's an active ulcer or a healed ulcer, okay? So if at baseline they have some scab over the ulcer, you still have to decide, is that an active ulcer or an indeterminate ulcer? Indeterminate in terms of its activity.
So
Okay.
why can't you be an active ulcer after you've been an indeterminate ulcer?
No, you can afterwards, but you can't enter that ulcer into the study
As an inclusion
as an
criteria.
inclusion
If that's
criteria.
your
If you
active
think it's
ulcer.
an indeterminate ulcer.
Right, you can enter it because they have another one, but in general, most would say they want at least one or more active ulcers, onsetting within 8 weeks, la-di-da, a certain location on the hand. So, yeah, they could have 3 indeterminate, but that's not the inclusion that gets them in, but you'd still follow those. And as Jimmy said, an indeterminate could become active. They
Yes.
get a little bit of hand trauma going, and then, it's pretty obvious, scabs off and still got an ulcer there.
Because I have to say that many ulcers you see with a little bit of scab on it, they just developed and you know that it's new and it's not, in your mind, it's an active ulcer, even though it's got scab. And most studies have allowed you to, as we've shown, you make the decision whether it's active or not.
and all those studies have been negative.
Well,
I truly believe that this exercise is so important because unless and until we get our outcome measures clear in our mind, and it's clear out here that all of us look at active ulcers differently.
Right, so we want to try to work out a way to do it the
So-
same.
If I understand, when you see a patient with an ulcer, you just look at it and you see if there's a epithelialization or not, and you don't
No,
you
no, no.
don't do your idea with pain or duration.
I do all that, but I'm saying for
For
a
a clinical
clinical
trial
Yeah.
is different than what we would do in
For-
practice.
In-
Yeah, very hard.
in practice. Now, I do disagree with the last bullet point that you have. That if a previous active ulcers become indeterminate, then it cannot be called healed, and by default would still be considered active. I think if you go with that, then again the confusion occurs. If there's a loss of epithelialization, it's active. If it's epithelialized, then it's healed. And in the middle, whatever the eschar is there, or necrosis is there, or scab is there, it's indeterminate.
Yeah, but I mean, the goal of the study is to take active
It's a yes
ulcers
or no.
and to heal them,
Dichotomous.
right?
Right.
Yeah.
So
But
if
so-
during a study, something that was active, and then you see it at visit 1, and now you say it's indeterminate, in
It's
the end,
analyzed as a yes.
it's
active
analyzed
still.
as an active
It
ulcer.
has to default to, it's either a 0 or a 1.
It
so
doesn't
it's a yes or
become
no.
a healed ulcer until you say it's healed. It could be healed at the time,
Right.
but you can't tell. If you can't tell, you have to call it active still.
And it,
Well, I
well,
think you're
they'd
looking
have
at
to
the proportion.
statistically call it active.
Right.
You are still calling it indeterminate.
I think
Yes,
you
that's
actually
right.
don't even, you know, you don't even have to categorize it in some ways because you're looking for the proportion of ulcers that heal. And so
Right.
indeterminate and
Active are still
gonna be
counted as the
consistent.
not
Right.
healed.
They
Are
haven't
they?
reached the
Are they?
outcome.
Is that?
Yes.
Well, they haven't reached
Well,
the
right.
outcome
But you
of
have,
Right.
yeah, true, but you have to define what the outcome measure that you're going to analyze. So if 100 active ulcers become 50 indeterminates, become 20 healed on drug, whereas the others are much different, and the main difference is in the indeterminates. And it could be that your study wasn't long enough to go all the way to healed. I'm arguing that perhaps the rate of conversion of active to indeterminate should be included as an outcome or a partial
That's
outcome.
not up to us at this point.
Oh, true.
No, but you could.
It could be a secondary outcome, but it
Right,
would not,
right.
that ulcer, which could be healed, because you can't tell, would be considered active until you say it's healed
Right.
in the
But-
study.
But Maureen, I think they could handle it statistically however they want, but in general, if you were going to have a primary outcome that FDA or that
Right.
investigator or pharma said, we want to know the number of new ulcers, which is totally different then, and the rate of healing, indeterminate wouldn't be counted in the rate of healing, it would be yes, no. So all I don't know becomes yes still. So you'd lose something, but then we've been asked in many studies to do VAS of the primary ulcer or of ulcer burden overall. So we've done VAS scales for sure as the MD, not in addition to the patient. So sometimes you'll catch it on a different way. But that's why almost like you sort of say, if you had a scale, the way they tried to do it in Dr. Herrick's study, that takes some of the I don't know away. The I don't know just becomes some middle number.
Right.
You know,
Sorry, but I would argue that you don't have to include that in your definition right now. If it's active and at the end of the study it's indeterminate, you leave it indeterminate. You don't
Right.
predefine it as active. That you're shooting yourself in the foot. It's indeterminate, and then we'll do the data analysis according to whether your primary outcome is
Right,
this, secondary.
right. And
But
open label
it
extensions
wouldn't
are
be
long
you know,
enough
that's
to
right.
look and stuff.
And I wouldn't default to active. I think that would be a
was the
mistake.
point I was trying
Yeah.
to make. And in meetings with the FDA recently,
Yeah.
they do not consider this active to indeterminate as an outcome.
Right. But it's
Because that
indeterminate.
doesn't mean, it's not even clear, they want
Well, no,
healed,
I know,
proportion of
that's what
healed
I'm saying. So the bottom line is you can't say it's healed. That's
Agreed.
the bottom line.
We agree on
Yeah.
that.
Yeah,
That's
even
okay.
even though many people around this table would call it an improvement to go from
Yes.
active
Yes.
to indeterminate.
Yes,
Yeah.
might be an improvement.
That
but
is
So
it's-
the problem is perhaps
the gray area.
it's the gray area, but it's also what you label the gray area. And the indeterminate sounds as if it's not an improvement. And that's wrong. I
Well-
mean, now we can't probably
Right,
change the
it's-
It may be
FDA.
improved, but it's
Yeah.
not reached a
And
primary
some
outcome. Then you have to
studies-
decide what
yeah.
improved means. That's
Yeah.
a different issue.
And some studies way back when did partially heal.
Right.
And to me, that's a clinical variable that makes sense, because in clinic, if I'm treating you with drug X or topical Y or what have you, or just watching, and you are 70% better in a certain time frame, that might totally meet my expectations, right? Because you're not gonna fully heal a giant one in a short period of time, we just know that.
And in
So
terms of-
partially healed makes, to me,
Right.
that would be an improvement. Because when you meta-analyze these studies, there's probably 3 or 4 studies that actually showed something because
Yes.
of the partially healed.
I just want to go back to the second to last point for 1
Smaller.
second. So studies also about prevention of development of ulcers, not just healing of ulcers, right? So if a person comes in day one and there's nothing there in a certain area, and they come back month one and there's something in that area that you think is an ulcer, you know it's an ulcer, you will be swayed in terms of calling it indeterminate versus active ulcer, because you know it wasn't there a month ago, right? So that's okay. You don't, it's up to you to decide if this is indeterminate or not, and you may use the fact that it has appeared.
So you're saying time frame?
In a way, it's up to you, yes. It's up to the physician in the study to decide if an ulcer is active or not. That's still the same, right? So not being able to tell.
The definition of active has to say that you can see unepithelialized and deepithelialized.
That has not been the definition of active. As I said before, the definition of active has always left it to the physician to decide if they think there's something under that scar that is active or not, all right? So it's not the same. Indeterminate means you can't decide in your head, but if you can decide, if you think you can decide that there's something under there, then you decide.
That's a very important.
That's been the definition in all the
But
studies.
If something new appears.
Right,
I
if they have a
don't-
scab on their finger, they didn't, it was perfectly clear at baseline. They come in, there's a scab on the finger. Boy,
You have to decide.
But what would you call that?
I'd call that an ulcer.
So would I.
So would I.
I would say because in the time frame, indeterminate is swayed then towards active, whereas
That's right.
if they've had it for 5 months, so I'm doing a time thing now.
That's right.
Yes.
Where,
That's
you know, that
really-
scab will never
that's
heal.
really-
But you know
That's
why?
the same
It's because I
dangerous thing as the
figure
pain.
it's unlikely to have already run its course if it's a short follow-up.
Yeah. Don't
So
forget,
I
don't forget
know
that the
that's
bias in
not
the
the
studies should be against the drug working, right? That should be the bias. So if healing is the goal of the study, then saying it's indeterminate and not healed is a bias against the drug working, right? If prevention of new ulcers is the goal of the study, then determining that there is a new ulcer is a bias against the drug working. And that's why I think it's fair to call those new ulcers. That's the conservative point
But
of
I
view in the
think you-
study.
Yeah, but I think you've jumped a gate because your initial definition talked about deepithelialization. If you've
Epithelialization, right.
never seen that, if you've only
Right,
seen
then
that
it has to
scab,
be
it
indeterminate.
doesn't meet that initial
Yeah.
definition that you
Right,
put
I
up there.
think you can still capture that it's a new ulcer that you know has developed
new
over the past 4
lesion.
weeks or whatever, but it is indeterminate.
Yeah.
It's just
But
a
then
matter of
And-
it'll
right.
still not be included in the healed ulcers
And in the same way that we just talked about
You
it,
can analyze it.
when we analyzed
Okay,
it, by
let's go
default, it
back-
wouldn't be
let's go
healed,
back
wouldn't
then.
it be the active?
Yes.
Let's go back to the
Right.
definition
Yes.
of
Yes.
ulcers that's used in all the studies. This is the definition. The first part is, of course, it's denuded, which it's lost its continuity, but it could be denuded or it could be covered by a scab or necrotic tissue. If denudation is not clearly visible, loss of epithelialization of the epidermis and the dermis is to be determined by the investigator.
Right, but
So,
then you
do we
get-
want to
that's-
change that definition?
No, that's ulcer.
Yes.
That's ulcer. But now you're talking about active or indeterminate.
Yeah.
Okay.
So you have a scab
Okay.
as an ulcer,
Okay, good point.
but it's either active if you can see the denuded area or indeterminate. I mean, you gotta do one or another. You
Okay.
can't just
Okay.
be.
Okay.
Yeah.
So that's a good point. So this is the definition of
An
an
ulcer.
ulcer versus an active ulcer.
Okay.
It's not, I mean, I
And so if
I
you
took
have a
this as an active
scab
ulcer, but
or a
okay.
ischemic or whatever the gunk is on it that Marco never decided whether he decided what it was called anyway, then it's indeterminate.
So in other words, the first part of this is the definition. The second part is what we would then call indeterminate. If denudation is not clearly visible, by definition, it's indeterminate. Is that not true? If you can't see denudation.
Long.
In the case that you brought up of the new one, that would
Well,
be new but
I'm
indeterminate would still be captured as a new ulcer,
Yeah.
and it's not healed.
Right.
So I think we would still capture
Okay.
that.
Okay, so in other words,
Because you know what, to
it
be
can be
quite
a
honest,
new
I think
ulcer,
it
doesn't
right
have to be a new
indeterminate,
active
but I would
ulcer.
think that's active.
For the study,
Yeah.
it would be a
Right,
new ulcer, not
so
active.
I would too, but for the
Okay,
purpose
that's a
of
good
the
idea.
study, I would say it's by definition still new but
New.
indeterminate.
Right.
Okay,
Right.
so we accept this as the definition of an ulcer.
Right.
An active ulcer, you must be able to see the base of the ulcer. Okay?
If that's what we're going to define it, and that's
Is
the way
that,
it's
does
done.
everyone agree with that?
Or part of it.
not
Or
the
some-
base.
doesn't-
You can even just see that if you have a scab 3/4 over
Right.
it.
Yeah, any part of the
I
base.
still
Any
see an ulcer
part,
because
yeah.
I see
Correct.
part of the
That's
base,
right.
but I don't
Yeah.
see the center of the base.
Okay,
Yes.
any part of the
Yeah.
base. So it's not up to you to decide if there's a scab there that's covering a healed or an active ulcer. Okay?
But
very
then,
good.
but then,
Can you
and
type
then,
and come
if
back
there's
with
a scab covering the whole lesion, then it's by definition indeterminate,
By
or you
definition?
still leave it up
Yes.
to us.
It's-
No.
No,
Okay,
leave up
so
to
then it's
determine if
called
it's an
that.
ulcer.
This is an ulcer.
Okay.
It's
It's
an ulcer,
still
but
indeterminate.
it's still it's an indeterminate ulcer. You
Okay.
don't know if it's active or
Okay,
not.
okay.
Mhm.
Okay. So let's go on. Okay. You've seen the words no ulcer, healed ulcer, or inactive ulcer. Is there any difference between these terms at all? If a site previously had an active ulcer and now any of those terms is applied, can we take that to mean the ulcer has healed? Okay. If a site previously had an ulcer,
So,
and
right
now
second
you say either,
still.
use the words either no ulcer or healed or inactive, like is used in Herrick's study, we can assume that that ulcer as a healed ulcer. I think we can agree with that,
Yes.
right?
But then we shouldn't use all those terms.
No, we're not going to.
Right.
It should be considered a healed ulcer.
Yes.
Right.
Right. So if at the first visit we call it something a fissure, no ulcer, or one of the others, that shouldn't matter in the end. It means it is not something we will follow to see if it heals, if it's a no ulcer at the beginning, okay? So I think we could retain the terms no ulcer and healed ulcer. And because,
in a
you
study,
understand?
you're not going to have a no ulcer. For this, you have to have an ulcer because you're defining lesions, and that's why you have a no ulcer. In a study, you're not going to have such a thing as a no ulcer.
Well,
you have
no,
the
if they come, if there was a
categorizing.
big ulcer and you see them 6 months later and you
It's
can't see
healed.
anything there,
It's healed. That ulcer was
For
there.
the
it was
study, you would
healed.
have measured it
Study.
already, and now
well,
it will be
healed.
healed.
it's healed. You could call it, there's no ulcer there now, which would mean healed because it was a previous ulcer.
Right, but that's
Okay? Okay. So for our purposes today, actually in doing the reliability study, we're going to retain the terms not an ulcer, it's an active ulcer, it's an indeterminate ulcer, it's a healed ulcer. Okay? Good. Okay. So Herrick's study, which used different words, it's not that important if observers cannot decide between no ulcer and inactive ulcer. In the end, it means about the same.
So what would people call this right now? I mean, this is a beautiful picture. Is that a scab? Is that epithelialization?
Okay. So
Okay,
first of all,
yeah.
is that an ulcer? Would you all agree that this is
Yes.
an ulcer?
Was.
I think we would all agree this is an ulcer. Can anyone say that this is a healed ulcer?
I think I might call it healed. But I'm not sure. I'd have to probably touch that
Yeah.
stuff and see.
How do you know if it's healed?
Because I kind of sense it might be, but if it feels like a scab in the middle, I call it indeterminate, but I have a pretty good sense that that is not, it's between indeterminate and healed, so I'm
No.
like.
I think that could easily
Right?
be an active ulcer.
Yeah.
Under that
I
scab,
think
it could
it
be,
is.
I'd call it, yeah,
That's
that would
an
be
indeterminate ulcer.
It could be.
Yes.
so we'd have to call it indeterminate ulcer,
Why,
okay?
Yeah.
Janet, that you're bringing up.
I think the
the
issue of pain that you talked about here,
Yes.
I want to stay away from.
See, I would have used pain to help me personally.
Yeah, me
But
too in clinical
but-
practice.
But we're not going to allow ourselves to, because we decided we're not going to do that.
Yes.
Pain
So-
is a separate measurement, separate outcome.
Yes.
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 Yeah.
And because some of them are more painful than you think. And you go, what is
Right.
wrong with them?
Mm-hmm.
Because some are, they're maybe
And
deeper
some
at the
people
core.
have more pain than
Yes,
others.
exactly. So I don't sway, like obviously big honking ulcer, you know, is bad, whether they have a lot of pain
Yeah, I
or
don't know.
training
I-
session.
yeah.
But,
If we have time.
right.
We will,
But
but I don't
see,
know
if
what they
I
have.
felt that and it wasn't
Well, I was
sort of
just saying to
scab,
Janet, that's the whole
I
point
would
of
say
today
this is
versus
healed.
the
Because sometimes, I don't know.
Well, part of it too is trying to get a three-dimensional sense of depth. The area sort of toward the nail, to me, looks a
I
little
would say
deep.
partially healed.
Yeah,
So
and,
that's
So it's
indeterminate.
It's indeterminate.
yeah, yeah.
That's
But
a
that
good
thing
example.
that might take a long, long time. And I'm not
To
gonna,
lift off.
right, I'm not gonna consider treatment on that, that's for sure. That would never get in on an enrollment. But I don't, like clinically, it's sort of not.
Okay, so I looked at the Herrick photos, and the biggest areas of disagreement were mostly between no ulcer versus inactive ulcer, because you used the word inactive, okay? Which
We're
was
not
sort of-
using it.
We're not using that term. But
Yeah.
those are the ones that are hardest to
To me,
decide.
inactive is
Okay.
easier than indeterminate.
Although if you go back, we're not using that terminology, but using this, it would make a big difference because no ulcer.
We're using no ulcer, active, indeterminate,
That's right.
or healed.
But if we had called this no ulcer, this would be healed according to our
Yeah.
terminology.
Yeah.
It would make a big difference.
It would make a
So
big
we have to be
difference.
careful.
Yeah.
Well, I think that's a scab, so I would call it indeterminate. Again,
No, I agree.
yeah.
In our, but here it makes a difference. If you call it no ulcer, that's healed. So,
No. We all agree this is an ulcer,
Okay.
okay? It's an indeterminate ulcer, though,
No, okay.
okay? So if it's a study of prevention, this is a new ulcer that has appeared. We don't know if it's healed yet, but it's a new ulcer.
Can you just remind me why you say it's an indeterminate?
Because you can't see the base of the ulcer, so you can't tell if it's completely epithelialized or if it's still
So
de-epithelialized.
if you see a scab, it's always indeterminate?
That's the bottom line.
Yeah.
That's what if you
If
see
you
a
see
Unless you can see
part of the
100%
base.
covers it, yes.
100% of the base.
Yeah.
Okay.
Complete.
If a scab covers it 100%?
100%. You
Yeah.
can't
So
tell.
you think it's 100% that?
So yeah, I mean, in real life, when we look at this, like Maureen was saying, in 3D, you might be able to see
Yeah.
part of the ulcer
Yeah.
base.
Well, if you
There's
can,
a
that's fine.
depth
If you
around
can,
the
that's
scab,
that's
right?
fine.
For me, it's
Then
not.
it's
Yeah.
So that's why looking at photos is so
Yeah.
different.
It's not the same as looking at people.
Mhm.
I agree.
Yeah.
Okay.
Yeah,
So pain, we've decided we're not using. So
So that's indeterminate, although
So
when
you
you
can
go down
argue
there,
that
Yeah.
there's
There-
lots of
there's that, yeah.
This
epithelialization
is
there.
active for me.
Yes.
down here,
I would
right?
Yeah, yeah,
Part, yeah.
Yes.
yeah. Now,
again, you have to look at it in 3D.
Yeah.
yeah,
So there's a little bit of de-epithelialized stuff down
it
here.
appears, yeah.
Then this would be an active
active
ulcer,
ulcer.
okay? And you wouldn't use pain to decide even though this is killing the person, okay?
Yeah.
All right. So in the following slides, think about you're deciding for the purposes of a study.
Oh, wait, about the other one, now, what about the position
Yes.
of that ulcer?
Okay, go back one.
Yeah,
Okay.
Because there's also a good question to ask about the other things that are not.
Okay, so we haven't, I haven't really brought that up. We weren't going to discuss that, but you want to decide if an ulcer is a volar distal ischemic ulcer.
I think that, I mean, Dinesh says that they're not including those. They specifically told us they were, so
Well, they're
I don't,
measuring
I don't
Including
know.
what?
primary
Including what?
outcome.
Volar,
Yeah.
dorsal.
Dorsal.
They're including dorsal.
But that again is the study criteria. That's
Right.
not that.
Okay.
Yeah.
But you want to ask the question here, if
Yeah.
a study says we only want to include volar distal ulcers that are below the median line on the side of
That's
the
a
finger.
definition.
That's right. So if we would do that, would this
That
Yeah.
crosses.
would this ulcer here be included?
Yes.
Because it's
Yeah.
below the median line.
right.
And this
that's
ulcer, which kind of
halfway.
crosses the
Crosses.
median,
Yeah.
Really?
Crosses
Because it's
the-
in. It's
if
above and
if it
below.
touches,
Okay.
if it touches the
Yes,
median line,
that's okay.
it makes it.
Okay.
Yeah,
And the
Okay.
first one is touching too.
Right.
Yes, oh, yeah, yeah.
Okay, I want to ask a question though
Yes.
about this one here.
This
So
one here.
this jobby right there, if that started in the study,
here.
at the end of the study,
Little tiny ulcer here.
Well, that's not an,
That looks
that's a,
healed
that looks
to
like
me.
a scar.
I think
Yeah.
it's hard to
It's
tell from
healed
the
to me.
photo.
right, so we would call that a healed ulcer or no ulcer, which means healed ulcer. If it started in the study, this is
And
the
now
end of
looks
the
like
study,
that?
it's a long one. And it was included, it was allowed to be measured in it. That to
Healed.
me is fully healed. I just want to make sure people would.
Yeah. Yeah.
Because
Okay.
I don't think it's a fissure, I think it was an ulcer by the
Okay.
shape of it.
It's
Yeah.
fine. But if it's
Okay.
healed, it doesn't matter if you call
Right.
it ulcer, no ulcer, it's not going to matter at the beginning of the study.
Yeah, I
Right.
think
At
it
the
is,
beginning of the
at the
study.
beginning, yeah, but I
Well,
think
even
it's
during the
nice.
study, if you can't decide if it's no ulcer,
Okay.
if you decide it's not an ulcer or it's healed, if it was an ulcer, it's healed, the
Yeah.
bottom line. So it doesn't matter for the study either, okay?
But it does help to have that term healed ulcer, because to say no ulcer implies it's normal. And if you can use the term healed ulcer, it makes me feel better.
Right, okay.
Or it was
Right.
something else. No ulcer means it's calcinosis, it's
Yeah.
a fissure, it's
Yeah, yeah.
something out.
Okay, so we're going to look at some Bavarian's pictures here, all right? And what we want to decide, this is going to be for a trial. Is it an ulcer or not? If it's an ulcer, is it active? is it healed or is it indeterminate? All right. And indeterminate, we're going to use our definition of cannot judge whether it's active or healed. And we're not going to use pain because they're pictures anyway. And when we see our patients today, we're not going to use pain. Okay. If we disagree, we're going to determine why we disagree and try to come to consensus. All right. Pain would not make a difference for consensus. We've decided that. Okay. So these were some of the active ulcers in her study. Would anyone disagree? This looks like an active ulcer. You probably could see a little bit of the base here, I assume. Okay. Here it's pretty obvious.
Right.
Say that again.
Because it could be the cream
Oh yeah.
they put on.
I'm not sure it's a good point.
Or it could
That
be
little dot there, is that calcium?
Flashback from the.
Yeah, from the camera. But
Yeah.
it could
Yeah, it
be,
could be
a lot
that.
of them put goopy stuff that's white. Then I say, what'd you put on?
Yeah.
Well, this white
Could be.
stuff.
Okay.
Yeah, but
Here, it's got some base showing.
yeah,
Mhm.
yeah,
We'd
yeah.
agree with that.
Oh, what? But it's on the wrong side of the finger.
Well, but it's still
Well,
it still
okay,
depends on the kind of
still
study
right,
you're doing.
right.
Right.
Okay,
I
okay.
don't
Okay.
really
But
care
it's an
on
ulcer.
the
Right,
location.
right, right.
That's the inclusion criteria. But yeah.
Does anybody doubt this is ischemia, even though it's on the wrong side of the finger? No.
But
Okay.
it could have started out as.
Now you know this one.
This
you
one
know,
they all called active.
See, I'm not sure I'd call that active.
Yeah.
Because I think
I
that
don't-
edge of it.
I mean, that's a
loss
scab.
of
You don't see any deepitalization out here.
Is it
Well,
not
what about all
active?
around it? Don't you think that's all loss of
Well, again,
epithelialization
you
around
have to
it?
look at the finger,
Is
but
that all healed?
Is
there?
that all
Yeah.
healed?
Yeah.
It's shiny because it's new skin.
Yeah.
Well, it looks to me like there was a bigger ulcer here before.
Right,
And
that's
And then
Yeah.
all this has healed in.
right.
And this hasn't.
Right.
Yeah.
Correct.
And
Well,
that's
so
why
the
they
question
call this,
right at the top
that's why they
there-
call this,
Look
that's
up-
a scab.
No,
here?
down, a little bit down, right in there, a little
Yeah.
bit below there.
Here.
Yes, right in there.
There's
That looked to me like you could say it's still denuded.
I see.
Which is interesting because I wondered
I
about
thought this
go
was-
down on your little arrow into the
Right
center
there,
of that
right in
scab thing. Right there, I couldn't tell. Up a bit, yeah.
But-
right in there, I couldn't tell.
I
On a
suppose that's
picture,
where you're.
Because to me, that still would be indeterminate.
But I suppose that's where you might be missing a piece of the puzzle, is that if that had come in as a very active ulcer, and this is what it looks at the end of the study, you would want to capture that as a good outcome.
Right,
but
no,
that's
but it can't, but
improved,
that's-
but
it's
you
improved.
can't.
Improved.
But if
It's
you were.
still indeterminate.
Yeah, now if you were measuring it, and if your measurement got part of the outcome, or it was included in the outcome analysis, you'd be able to
Yes.
measure the improvements.
Yes.
Because obviously, if it started out as huge and now is
Yes.
20%, I mean,
Yes.
the patient's happy,
Yes.
you're happy,
Okay.
but
But
the
I think
FDA's not happy.
we, based on our definitions here,
It's all or nothing.
distinct from the hair group, we would call this indeterminate. I think that's
Well,
the
again,
feeling.
Except for
there's
that
this
little
one-
edge,
the-
which
the
we have
little
to-
Maybe.
edge, no.
Here.
Right in that area.
Yeah, I'm just not sure, right? Maybe this little
Right
white,
there,
red
right
line
in
there.
there.
we
I
got
can't
to.
tell, because it looks like there's a difference of depth in
Yeah.
that scab.
We just have to look at the.
Okay,
Right.
See a
okay.
figure, yeah.
But
And, sorry, any more comments?
But then, just to be clear, it would have come in as an active ulcer, and if we agreed, and I also think that there might be a little active part there, it would end up as an active ulcer.
Yes.
If you call it active, it's still active, yeah.
Boy.
Right.
It can be
See,
improved, but
that-
it's
that's
active.
the problem
if
with the
that
way the
area
analysis
truly is
is, I
scabbed
mean,
over, if you look, at both, and that other part is just, it's sort of a divot in the skin but not
but
open,
shown, yeah.
then to me, this would be an indeterminate. And that's where it's really hard on a picture to kind of magnify with your own eyes, right? To say,
But still, to go from active to indeterminate doesn't get you to your outcome
Right.
and
No.
doesn't capture the improvement.
That's right,
Right.
100%.
But if I VAS'd it as my thing. it
Well,
would
if you had a
be
scale, that would be a
moderate
different issue, yeah. Is
Right, it'd be a
improved.
It's
moderate
gonna be a
improvement.
You're
position
gonna add a
one.
scale for
Or
how much.
market. No one
Yeah.
would say mild improvement, I don't think.
Yeah.
And this one, over the PIP,
It's hard to.
That's an
looks
ulcer.
pretty active. Looks like there's a
Looks-
white base that looks active,
Or
I
whether
think.
that's calcium.
And
or
this
that.
one they also, I think, called
No.
middle DIP, yeah. And I can't really tell from the
Well, I
picture.
think it's right at the very bottom part.
Yeah, right here.
The
I
bottom.
can't tell that easily.
Yeah.
But again, yeah.
Okay. These were ones they all called inactive ulcers. Okay.
Boy.
So
I know, season.
yeah, it keeps seizing. I don't know why. Sorry. Stopped completely. So this one on the left, I presume they felt that, even though to me it looks a bit de-epithelialized in the middle. I guess people looked at the pictures, thought it was all epithelialized. This one in the center, I don't know, there's a little bit of something in the center here, eh? Would everyone have called that healed? Or
Yes.
inactive?
I think I would
Inactive?
call that healed.
Yeah, okay. And
So
here,
that means it's not, an inactive one means no, it's not an ulcer.
Correct.
no,
longer.
no, it
There's no
means
inactive.
it's an ulcer, but it's healed, basically.
Yeah.
Inactive would
Yeah.
mean essentially
Well, we are
means it's
not
healed.
using
We're
that.
not using
No,
healed. There is no
Using
inactive.
healed.
We're using healed. For us, it would be healed.
Yeah.
Would you call this a healed ulcer?
Yeah.
I think so.
Yeah. And here, it's hard to tell which one they were looking at, but, okay.
Well, they look-
And I think we
everything
should
looks healed
clarify
there.
that digital pitting scars will be called no ulcers. So if people are pitting scars like that, most of them are pitting scars except for one maybe there.
Yeah, I don't know what they're calling.
So a digital pinning scar,
So
even
you-
if it's painful, is, if you don't think it's, you can't see the base, it's not an
Right.
ulcer.
So are you going to have that? So you should have exclusions, that, fissures, calcinosis. Are you going
We
to
can-
discuss
yeah,
that?
we're gonna come to
you
that.
should have.
Okay? And these were no ulcers,
Uh-huh.
all right?
Well, it's hard to say this one. I mean,
Those
this
could
could
have,
be
that could have been a
healed.
big
Epithelialization,
ulcer.
again,
Yeah,
you know,
why
you
is
have
that
to.
no ulcer? It's a healed ulcer.
I think it's a healed ulcer.
Does no ulcer to them mean healed?
This is
Well,
what
I
digital
guess it's a
pitting
matter.
No.
No, see, it is there. The lesion on the finger pulp
It's not
was thought to be.
They use the word
superficial
inactive, which would be an ulcer
Okay.
that is healed
Yeah,
essentially.
so that's fine. That's healed.
You call
And then
this,
that's a-
but no ulcer is different. No ulcer is like a
Yeah,
fissure, the
that's
things
what
we
they
talked
say
about
there.
before.
It's a fissure.
It's not an ulcer.
Fissure.
So this one I think we would have called either a healed or maybe indeterminate even, but an ulcer.
So a definition between no ulcer and healed ulcer for us is gonna be very hard.
Yeah.
Well, these
But
are
it'll
all
be
no
analyzed
ulcers.
the same way.
Fissures, digital pitting scars.
This is a fissure.
Yeah.
Yeah, so.
This is not an
this is-
ulcer.
Yeah,
These are digital pitting scars, which are not ulcers.
yeah.
This picture, I'm not even sure what we're looking at. And this lesion here,
Is a healed ulcer.
they called it, no, I would call
And I
this,
think down there's healed too, way down, like I know a lot of the definitions
Close to-
go,
yeah, that's-
yeah, there, but also proximally, way down. A lot of those won't be allowed in anyway because,
Yeah.
that proximal one. But that to me looks like there was an ulcer and it was healed, not
Yes,
just a
to me too.
fissure or,
Yeah.
because it's pretty,
I would have
Looks
called
like
Well,
it,
it
it's
had depth.
all the mechanics' hands scraping
Yes.
type of
Tough,
stuff,
yeah.
those are
right,
all.
but they'd never be included in a
No.
study, but if they had it at the beginning.
but certainly to me, this lesion looks like it
Could've
is or was an ulcer. Or if it just was, then I would call this a healed ulcer. Would you all agree on that, I think?
Can't
So
tell
it's like
whether
we're all.
Well, if you had
Yeah.
been measuring it as part of the study, and you
Okay.
had been measuring it, you would have said it was healed. Yeah.
Okay. So what's this? Is this an ulcer?
Indeterminate.
Indeterminate.
It's an ulcer. We all agree it's an ulcer?
It's
Yes.
an ulcer, yes.
And nowhere can we see the base?
Because it's got that junky stuff.
So we're gonna
Probably
call this
here.
indeterminate.
Yeah.
What does he
Oh,
call this?
Indeterminate.
No, what did Marco call that stuff? I can't think of it.
Gooey stuff.
Goo.
Escar.
No, Ashgar was the hard
Scab,
part.
I don't know what
He
it's
had
for.
another name for it, I can't remember.
Okay. So
By the
this,
way, I agree, I'd call it indeterminate. You'd have to, in real life, look right in there. I think that's just a reflection, that it's not, that there's no ulcerative base. I
Yeah.
think
Okay.
it's fully scab, but
okay.
hard to know.
Okay. What do we call this?
Gunk.
You know, this is a hard one, and
That's
this
right.
becomes really hard one because you don't see any any base.
I'd have to say indeterminate.
But you know,
That's-
it is. I
it's-
mean,
yeah.
But
this
that's
is a.
terrible.
That's a.
Well, first of
active
all,
It's an
ulcer.
ischemic.
Do we call this an ulcer?
Yeah.
It's a critically
Yes.
ischemic
Yeah,
I think
disease.
that's-
in
Yeah.
Marco's definition, any gangrene at all is considered an ulcer.
Yeah.
Yeah.
Yeah,
I would
so-
have to say, my inclination here would be to call this, for purposes of a study, not an ulcer. That those things which are right at the very distal tip of the finger, that encircle the whole finger, are almost impossible to assess.
What are
Well, we'll call it an ischemic.
It's a complication in the
No, but that
mesenteric.
could have been an ulcer,
That's
Murray,
a-
4 weeks ago.
Yeah, yeah.
You could have had ulcer
The
all
tunnel,
along
and then something with
here,
tunnel.
and then
Infection.
go
Okay,
you have your
and
gangrene.
then
So,
and that would be okay. That would be
I think I have
okay.
to call it indeterminate, but I would call this a not good outcome from indeterminate, whereas the other one was markedly
Right, but
better.
you're
But you
jumping
would
to
also
good
call
outcome
this
of it.
somebody you would not enroll in the study?
Yeah.
Yeah.
You wouldn't put this
That's what I'm
person in the
asking.
study.
Someone you would
How are you
take
gonna
out.
measure
So
that?
so you only
Right.
want because you want to
Well,
treat them.
Right.
But
No,
you
but
can't
that's
call
an
them.
But if they
no,
walked in my
That's
door
right.
and I was
Right.
deciding if I was going to put them in the study, I wouldn't put them in the study.
Why?
Because I'd be doing something
No,
else.
Oh,
no,
'cause
what
you'd
if
be
the
treating them
study
else-
was active drug A that works and drug B that works and it's a
Yeah.
superiority study?
That's right.
No,
What if
so
it's
this
You
is-
can't
autocross
fix
versus
this.
PDE5?
This
You
is a
can't fix this.
complication.
This is
of
would be a
a
complication
digital
in the
ulcer.
mass
I can
intensive.
And that's
make that
difference
less
between
black
ulcer
all
and
the
a
time.
complication.
I with the drug.
For
time.
example, a gangrene is a complication of a digital ulcer. So from a study trial purposes, either A, that would be an exclusion criterion if they came with this, or B, if they develop this patient comes out and gets treated with the usual care.
But that's a different idea of an exclusion criteria. If this, it's possible that 2 months ago, some of this stuff was indeed necrotic. It's highly possible. So to me, by our definition, this might have to be indeterminate. I don't see
But
open
I think
stuff,
you're jumping.
and you would say, and by the way, my VAS is bad because
But
they're
by
gangrenous.
saying indeterminate,
They're skin.
you're saying that this is an ulcer.
That's right.
The question right now is this an ulcer?
That's right.
Yes
By
or
saying
no?
it's indeterminate,
Of
it's an
our
ulcer.
options, this is an ulcer.
I agree.
But how are you gonna measure that?
You said this is an ulcer?
Well, it's not one of these things, of our thing.
Well, this is gangrene. I mean,
Okay,
You see,
then
how
that's
is
not
this
our
gangrene
that's
and
not
ulcer?
an option.
How is this going to heal? It's going to
No,
heal by
that's
the
not-
tip,
I-
by
If
the
it's not an
that's
ulcer,
what
it
I'm
doesn't
saying.
get included.
Of these things,
Yes.
It's indeterminate.
it's an ulcer that's indeterminate.
I agree. Yeah. Me too. I would
Because
say.
there's all sorts of
No.
areas that are potentially indeterminate.
You don't, then
There's
give
a
us
road
another
here.
column.
What
Right,
happens
right,
if
right.
somebody's
Give
about
us
to have
another
auto
column.
amputation?
That's right. So then you
Give
exclude
us
those.
another column.
People can't hear us on the tape. What? One person at a
Give
time.
us another column, and this is, I don't see how you.
Well, how
can-
about this is not an ulcer. This is
This could be considered
gangrene.
not an ulcer.
This is not an ulcer.
For study purposes, this could be considered not an ulcer. And so if that's the case, we have to have a definition
Of
for
what
why this is
not-
not an ulcer.
Correct.
So,
That
Laura,
not an
what?
ulcer could be gangrene.
This is gangrene.
This is gangrene. You feel this is probably early gangrene.
Although you can see
Would
it
everybody-
underneath
Probably it
there.
is
But it's got a
gangrene.
lot of, it's got a lot of but I've
That
seen,
can
but
heal.
that can heal, that can heal
Oh,
without
it can heal.
amputation.
Well, you're going to
Well,
lose
it may
tissue.
not.
You're going to lose.
You're going to lose tissue.
Oh,
sure.
yes, with
Yeah.
significant
Well, they've
tissue
already
loss.
lost a bunch of pulp to begin with,
So
right?
I think, I agree that this, to me, is not an ulcer. This is a gangrenous distal, very distal tip process, which is not just the skin, it's deeper. The ischemia is probably different, it's probably a larger vessel than just the kind of vessels that give you the little digital ulcers. It encircles the whole fingertip. I would say this is not an ulcer for
But-
study purposes.
No, today, but Murray, this could have been an ulcer,
No, no,
and
no,
now
but,
it's
but
Fine.
of our options,
It's in
Okay.
options, if you want to define not an ulcer to include gangrene, that's fine.
Okay, so let's go
But
back.
of our three things, when
It
you
has
say
to be
not an
indeterminate.
ulcer, I mean,
No. So that she makes a good point. Janet makes a good point. Let's say this was an ulcer at the beginning,
Because that's-
and
that's
then
not-
they've
Right.
come back for another
Right,
visit,
it's indeterminate.
and now you have this, right?
Yes.
You're not going to call this not an ulcer now because that would mean it healed, all right?
Yeah, you can't.
So I think that in that situation you would call this indeterminate until there's some complete healing.
Are you
But you
gonna
would-
treat that patient with iloprost or?
no.
That's a
But
different
that's a different issue. The question is, are you going to
So
define
it's
not
gonna
an
be out of
ulcer
the study.
as being other things, including gangrene and calcinosis, not a clinically active or determinate,
If-
indeterminate ulcer, and that's fine.
But I think you have to understand, if the patient walks in with this today as a baseline, that's not an ulcer. If the patient had an ulcer in that area and they walk in with this today, you're probably going to have to call this indeterminate or
Then-
active.
It's a
Then I disagree.
complication of that ulcer. I mean, that's a different issue.
Yeah.
You won't be able to convince a community by calling this thing as not an ulcer.
I
There's
agree.
no way the community will buy a gangrene of a finger as not an ulcer.
So I agree. You
Classification.
can't. I
No,
agree
I
that
don't
you
think so.
cannot say that it's not an ulcer at one point in time and then indeterminate in another. Either it is or it isn't, and I think it is. But you might say that you exclude complications of ulcers, including gangrene, blah blah
Yeah.
blah. blah, blah. But it's an ulcer.
inclusion. But if this was in the study, to me, that is indeterminate. That is certainly not healed, but it doesn't meet our criteria
Actually,
for
more people
active.
call it active. And then-
Well, I would call it not a good thing.
Yeah, everybody would
But-
call
But
it
we would-
But the,
In dual, we would
the
capture this as a
indeterminate
complication
is
and they'd be
that-
out.
Right,
Yeah,
exactly.
that's what
right.
I'm saying.
Is it,
And
Laura?
in the Mass 10 study, this would be considered a complication, and they would be out of the study. This
Yeah.
would-
Either at
this would end
baseline
it.
or during follow-up.
And that
At
would be,
baseline,
and that's
they
the
would be-
outcome.
That's right.
So
And that's the
gangrene-
outcome. You capture it as a
We're going
bad
to call
outcome.
gangrene as a, I don't agree with that, but you're saying gangrene is a complication of an ulcer. To me, gangrene just can just happen by itself. You don't have to have an ulcer. All of a sudden, the whole distal
No, it
finger
can,
is
but
black.
if this started, if this is the patient you talked about, this
It
started as an ulcer, and then they came in looking like this, in that study, they would be out, it would be a complication,
Oh,
that's
I
the
see.
outcome.
So they would be they would be then dropped from the study
Right.
because they have a for that ulcer anyway.
Yes.
Right.
That ulcer would be dropped from the study if
Actually,
a
they-
complication.
The patient would be,
They
the
would
patient would be
Because
dropped
they'd
from the
be out.
study.
It's a different
well,
finger.
but that's an ethical reason.
Right.
What you want to actually say today
Okay.
by the definition
Okay.
is, in my mind, this isn't indeterminate. It is indeterminate.
It's an ulcer,
It
and
is
it's
complicated,
Yeah.
but it's, I can't see an open area, and I assume there have been an open area at some point. I'm sure there have been.
I think
Exactly.
it becomes difficult if somebody has auto amputation during the study. If somebody has, I mean, those things are rare, but what do you call an auto amputation? Do you call that a finger falling off as indeterminate ulcer?
What is our definition though? Our definition of ulcer included gangrene. If you, that
No.
first definition, or
No.
necrosis, necrotic.
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 It's not gangrene.
Base, yeah, it didn't say
Right.
gangrene, but it said necrotic. Because I would be fairly certain there's been open areas at many points in time, or at some point in time, because of how you look at it. So to me, it'd be indeterminate, and we do see that, right? We see people really bad, moderately bad, and some will actually get a better outcome than others in the end. That's a different criteria about whether you say it's a complication and whether you say we exclude them, because you could truly have a trial designed as best care plus drug X versus best care, and everyone would be allowed to keep this person in there and then treat them. Right? It depends on the design of the trial.
Mhm.
But I couldn't call this not an ulcer in good
Unless you,
conscience. I couldn't.
unless you define not an ulcer
As
as being
including
gangrene
gangrene.
and
Yes,
infection.
that's right.
Yeah, yeah,
I mean,
because,
if this patient came in today with this, and they were being, you were asked to assess them for inclusion in the trial. Let's deal with this. What would you call this?
They
An
will be
ulcer or
included.
not?
Not an ulcer,
Not an ulcer because
it's gangrene.
it's gangrene. Fine. If they had an ulcer before, and then you saw them in a follow-up visit, and they have this, what are you going to call it?
Gangrene.
Gangrene, and therefore they're an exclusion?
Yeah.
You drop them from the trial?
Yeah.
No, but what are you calling it?
Depends on the
Active?
trial.
Depends on the trial. Okay, depends on the
Does,
trial.
depends on the trial.
So we
So
could
is that
call.
active or indeterminate? You only have three, well, an ulcer to go to not an ulcer means healed, frankly. You can't go from an ulcer and then be not an
So,
ulcer.
but we're only doing this as far as just a one-time thing, so it's not over.
But I think we have to decide about the trial concept, that it seems to me, if you could exclude, but you could say, look, this has become, an ulcer has turned into gangrene. If that's not an exclusion from the trial, then this is now gangrene, but it's not a healed ulcer. And it's not, that ulcer hasn't healed until that gangrenous area has completely healed. Or no? Does that sound
Right.
reasonable?
So,
Mhm.
yeah, whether you call it active or indeterminate, it's still not gonna be healed.
That's
So
right.
it'll be captured as not healed.
That's right. That's right.
But,
You could decide to exclude them because now if you
Right.
drop them if you want, that's up to you as a trial designer. But so at the beginning, if they walk in like this, it's not an ulcer because it's gangrene, it's the distal tip of the finger.
No, it's not an active ulcer because it doesn't meet the active ulcer definition. It's an indeterminate. You can't say it's this definition here and that definition there, right?
No, I don't think that's what we're saying. I think we're saying gangrenous lesions are not the same as ulcers.
Indeterminate was
An
ulcer
ulcer,
that
with
you can't see,
escar,
right.
yes, that you can't tell.
necrosis, or
This is a
gangrene
different
is-
concept.
Right.
This is
And I think
too
there's
big
some
to
escar
call
in
an
there,
ulcer.
the
This is
necrosis.
gangrene. This is not an ulcer for the purpose of entry into the trial. As you follow them up, it's a bit of a different concept, and that has to be written into the trial how that's done. Okay, we'll move on. They couldn't decide if this was either no ulcer or inactive versus an active ulcer.
So I'm
It's an
not
ulcer.
sure whether there's a
No
scab or
ulcer.
there's a.
So it's
Right.
definitely an ulcer.
It's definitely
Question
an
is-
ulcer.
Definitely an ulcer.
Yeah.
We all
Yeah.
agree it's definitely an ulcer.
Yeah.
It's an ulcer.
And if you can't see the base, we would call this indeterminate.
Yeah.
Okay.
Same thing.
Couldn't decide here either. Is this
That's an ulcer.
Indeterminate.
it's a
That's
definite
an
ulcer,
indeterminate.
but it's
It's through the
indeterminate?
skin, yeah.
Okay. Ah,
No
That's-
ulcer.
No ulcer.
Healed.
That fish. I don't know.
This here.
Fissure.
No.
No, it's Barnes.
no ulcer.
No,
There's no
because there's no.
depolarization.
It's not demarcated well enough.
Well, I don't know that, like,
there's
there's
three
three
little
parts to
separate
it.
areas
The top
here.
part- Right, the top part.
Here.
Might be right there.
Clear, I mean, that may be, a
Depth.
base,
Yes.
an ulcerated base, but you'd have to see it in person to be able to say that, so.
Okay.
And that might be why they couldn't tell, because they would question that part.
Yeah,
Because if you go down, go below the dot,
Yeah.
down here and over Murray,
Yeah.
that's not an
Not an
ulcer.
ulcer.
No, that's not an
That's-
ulcer. I think they were
Yeah, it's
looking at
not
this.
open.
Yeah.
So most of us think not an ulcer, but if you look really carefully at this area, if you thought there was de-epithelialization there, you'd call it an ulcer, probably
Yeah.
active as well, eh? Okay. Sorry, this is not a good photo. I'm gonna skip this.
Wait, go back, that's an important concept though. Because I don't understand why they're having a problem with it.
that looks like an old
Well, what's your point,
scar.
Janet?
Well,
It's not, it's kind of-
Well, maybe because there's so
first of all, it
much
might not be
reflection
the
that you can't
location
tell.
we're allowed in, but I don't see anything open there.
No.
No.
it's just another-
So it's
Maybe the
either
picture's not
healed
good.
or inactive.
Maybe they're
like,
concerned
is
about the
that-
reflection and they can't tell what was.
I thought this could be reflection from the camera.
That's what I think,
Right.
yeah.
So I thought this was just a bad photo.
Yeah.
Okay.
You can't tell.
It's not a good photo, but there is a definite ulcer down, I
Yeah.
think. There's a definite ulcer
Ulcer
down here.
indeterminate. I would bet, if I was a
Indeterminate.
betting person, that there's open stuff under the scab, but
So
you can't
right,
tell.
But it's indeterminate.
Or if
Yeah.
you could see the rest of it, maybe there's some area that
Yeah.
you'd be able to find
Yeah.
some
Down
loss of
here.
epithelialization that you could see.
Yeah.
Not a great photo, but they had trouble with this one.
Ulcer.
Also indeterminate.
Indeterminate. A lot of indeterminate
So I think
ulcers.
it's in their no ulcer definition that there might have been a
Yeah.
problem.
Yeah.
Well,
Yeah.
no, also,
Yeah.
no, it was this group versus this. In other words,
Oh, I see.
Because
I,
it's
I,
not
I lumped
there.
these together,
Okay,
Right.
okay, and they couldn't
But
decide.
They might be thinking there,
Active versus
they might be
inactive.
thinking there, they might be thinking in there that I can't tell because of the picture, right?
Or maybe they were thinking location. Is it-
No, location wasn't an
Location
issue.
wasn't
with the
Location
study.
wasn't an issue.
Yeah.
No. Okay, this we see a lot of.
Ooh,
Oh, yeah, that's not an ulcer.
probably no ulcer, yeah.
Yeah,
That's no ulcer.
that's no.
I think it's a healed one.
I
though,
think
because
it
could have
I
been
think
an
it might
ulcer.
actually
Could have
go
been an
down.
ulcer.
Well, yeah, or
Or was it almost
a
ulcer?
month from now, that could be an ulcer.
Yes.
But right now,
It's certainly not an active ulcer.
Around, well, pretty well demarcated lesion.
No depth.
no depth.
It's hard to know the
No
depth
loss.
right in the middle of it though. See, it looks like
Well,
it goes like a little ski slope down.
Yeah, there's a
Right
little bit of
there.
a scar. That's probably not as high
It's
up
really
as here.
superficial.
To
But
me,
it's not an
this is
active
an
ulcer.
ulcer. I think it might be a healed ulcer, but this looks like an ulcer to me. No?
I would say.
You'd say not an ulcer,
I
why?
would know. Because
No
there's
depth,
no
no, loss of
de-epithelialization.
epithelialization.
It's just a little crust there. I don't know. I call that a crust.
Crust.
I write that in my notes, crust. I don't know what it is. It's not an ulcer.
I
So we're
thi-
gonna call,
I think from a trial design, you'll have to look at how it looks in a 3D view, but
okay.
I think
so
it's
the,
no ulcer.
So
when
the
I
point
look
here
at
is that if there's any sense of a crater, if this
Yeah.
is lower than the surrounding skin,
or higher, or you
or
know,
higher,
when there's
there's
a
a
scar.
scar, around it. So you'd call this an ulcer has, if it was not completely parallel with the skin?
It had to be open to be an ulcer. So now that's not
Doesn't
open to me.
No,
No,
but
but
an
that's
ulcer
why I'm
could
calling
have
it a
a
healed
scar
ulcer.
or
I
a
wonder
scab.
if the person said, 3 weeks ago when I called, but you couldn't see me till now, this was open and really painful, and because it's so superficial, it's actually healed. So if they said it was open, I'd call it a healed ulcer, but I would never call that today an active ulcer to get you in.
Right.
But
Okay.
I call it healed, but I wouldn't even call it indeterminate.
Okay.
That's
But
to me.
So
if
if this,
never
so the
open, it's
the
an
bottom
ulcer.
line is you would not enter a
You
patient
couldn't
into a
enter this,
study
no.
Yeah.
where you
We
needed
can't.
an ulcer.
Yeah, and if they came in, if they had an ulcer there, and now it's 3 months later and it looks like that, I'd call it healed.
That's
So
right.
what I call it.
Right.
Well,
Because if you
that's
say
why
no
it's no
ulcer,
ulcer.
as we said before, it's healed.
It's
If it
healed.
was an
Right.
ulcer before.
If it
right?
was, yeah.
And if they were in a prevention trial and they didn't have this one visit and they had it the next visit, Would you
couldn't
call it an
call
ulcer that has
then.
appeared?
No.
No, because, well,
can't.
I
There's
would
no
say I
difference.
see something and I wonder if it's a healed thing, but I can, unless
Yeah.
if they had a really good, like if we did see them 2 weeks prior and it was open.
No, this is
right?
all you
So
see.
that's-
Between
It-
visit 1
today-
and visit 2, they
yeah.
develop
No
this.
ulcer.
No
Have they
ulcer.
developed an ulcer?
No.
No ulcer because there's no depth, is that
No,
what you're saying?
no
Or-
deep,
No,
no,
no loss of epithelial.
But
No
Maureen,
loss of
what if they do
epitheliation.
say
Doesn't have
that
either
it
of the
was
two
open,
criteria.
Now it's not.
You can't depend on that.
Right, you can't,
Can't.
yes, yeah, I agree.
Yeah.
So, Mary, what happens if there was a small denuded area out there?
Small
out
what?
there? Small deepithelialization of
Yeah.
the
Yeah.
data.
Then it's an
Would you call that an ulcer?
Okay, so now you're saying that the size matters, that if it's a pinpoint,
Mm.
and say that there was a little pinpoint deepitheliation,
What I've got with the
Has to have
discussion
depth,
today is
though.
that
If you want a little
investigators,
pinpoint, can you say
we are
there's
trying to
pinpoints?
look for any sign of deepithelialization, and that's why probably one of the reasons that the trials have been negative, and we haven't taken the pictures, but any little crater that we see in these trials, we recruit that patient into the study.
Mhm.
Yes.
And you know, that's why the inclusion criteria need to be more enriched with within 8 weeks pain or anything
Or
like
size
that,
Or
of
a
size.
size and
size,
things
it
like
has
that.
to be at least
But-
more than a half.
But with all the discussion we had today, we are looking for any reason where we can call an ulcer an active ulcer,
That's right.
right?
That's
I mean,
right.
that's
right.
what we've
That's
been trying
right.
to find
That's
every
right.
nook and corner.
And so what do you feel about that?
Well, I think we can't change that, but then the inclusion criteria need to be enriched enough. So if we include those patients, they are likely going to be true ischemic ulcers. That's all we can do. We can't change.
Okay, so this ulcer, this is not an ulcer, this is not an
That's
ulcer.
not
Okay,
an
we all
ulcer.
agree with that.
That's a bad picture.
Well, but
Looks
it's either
If it
not
is
an
something
ulcer.
healed, I would call it healed ulcer.
healed.
Okay, probably healed,
I
right?
wouldn't call
Yeah,
it
little-
healed.
Probably
Determinate
is an
body.
ulcer.
Yeah.
Is that helpful?
Is it-
Well, I think it's at
It's a- it's a
PIP.
It's not a great picture, sorry.
Flex
Right,
PIP.
I guess the only question again I'd have is.
Yeah,
the
little
over
dots.
this way,
Yeah,
the
I
little
wonder.
dot.
And that would be indeterminate.
This?
No.
No.
On-
In the
on
ulcer.
middle.
In the ulcer,
I
yeah.
wonder about.
Yeah,
This
yeah.
dot here.
And
Yeah.
again, that's the pinpoint opening.
Right, but I would.
Yeah, see, that's exactly.
That's the pinpoint opening.
Is
Yep.
that an active ulcer?
No.
Why not?
That would be indeterminate because
Why?
it's, there's a scab, a little scab over
Yeah,
or
but
it
you
looks
look,
as-
there's an opening there.
I don't know. I can't tell.
Can you show that opening? This one.
Yeah.
I can't tell.
So,
Yeah.
If
so
it's
the
open-
difference, it's either, in my mind, it's either healed or indeterminate, and it would be how much I really think I can find
But if,
scab and that.
okay, if
hole
that
or
was in the
not.
right place for a
And
particular
inclusions,
trial,
Yeah.
and they came in, it's a little tender, although we're not paying attention to that, do they get into the study? And I guess my sense is no, because, and perhaps it is that they need to be at least a millimeter or something, and I don't call pinpoint lesions an ulcer.
Yeah, usually the previous trials have been 2 millimeters, so I think that's.
Okay, so that's a good point. So that could be added to a particular trial. It could still be an ulcer, but the trial may require it to be of a certain size.
Yeah,
Well,
but we were
just
also.
say they usually require an active ulcer if it's a healing study, and that is not an active ulcer. So at best, it's indeterminate, and in some people's minds, it's healed.
Yeah.
Lori, which trial required 2 millimeter?
The rapids trials.
Mm,
I don't
I
think
don't
so.
think there was a
No.
size
No,
thing.
I don't think there was a size.
I just looked at them, yeah, so there definitely was, I don't remember if it was rapids 1 or rapids 2, but there were
Yeah,
definitely.
I think the
there was
original, I
definitely
think
two.
you're right, at least the
Primary-
original
primary-
rapids
The cardinal
one.
ulcer had to be.
Yeah,
Because to
yeah,
get
the
back,
cardinal ulcers.
yeah, to the prior discussion, when we were looking at something that had a scab on it, and we were trying to say active or indeterminate, and we said that if we could see an area that was deepithelialized, even if it were pinpoint, we would say it was an active ulcer, it was not indeterminate. So does that have bearing on this discussion?
I
Because this has no scab.
It becomes important we have definitions,
Uniform.
and then if we want to enrich them by saying 1 millimeter or 2 millimeters or inclusion criteria within 4 weeks with pain associated with that, you know, that what we can do.
Yeah.
But, you know, this is a perfect example where a definition right now says that that's an active ulcer.
Mhm.
Because
If-
there's a hole in
If the hole is down to the bottom.
That's right.
Okay.
Yes.
If there's no
Okay.
scab there.
Okay.
If there's a whole, right.
Agreed.
If there's a hole. Okay, good.
In other words, we're not sure.
Okay.
indeterminate.
I mean,
Ulcer.
It's an
ulcer,
ulcer.
yes.
It's an
It's an
ulcer.
ulcer,
Indeterminate.
right? And it's
Indeterminate.
covered, you think, completely?
I don't know if
Well,
it's
it's a-
indeterminate versus active on that one part, looks like, yeah.
Yeah,
Yeah, I think
Again-
it's indeterminate.
So it depends on what you see when you look at
Right,
it. Okay.
exactly.
And go back, Marie, the one beside it, the finger beside it,
Yeah.
over here,
Same
is
thing.
probably in the
Also
same boat, that it's
indeterminate.
Yes.
indeterminate.
Probably
Right?
is, yeah.
Yeah.
Agreed.
Probably, just looks like it was bigger at one time, right?
Right,
Yeah.
right, no, but it looks
Okay.
like there's a scab, so
Okay.
it's indeterminate.
This?
Ulcer healed or indeterminate. And I-
Ulcer indeterminate,
Yeah.
Indeterminate.
yeah.
Okay, because you can't, I think you can see the base, but
Where?
I think you see
Maybe
the
you can
base.
see the base.
I think this is
Yeah,
all the
that
base.
reddish stuff may be
Yeah,
the base.
I think this is all the base.
I don't
Yeah,
think that's
for
just
sure.
crusting.
Right,
That's
see, that's why to me
trusting
it's
to me.
indeterminate, but I guess,
See, all of us are trying to find that hole
Yes.
where we
Uh-huh.
can call
Yeah.
that an active ulcer.
Okay, well, it's up to you to determine, you know, as we
So
said,
can
can
you
you see the
remind me
base or not?
What
What?
the definition of healed ulcer?
Completely
epithelialized.
epithelialized.
Right.
so
You
if
have to
the
be able to
problem is
see the
indeterminate, you have
epithelialization.
Huge
Over.
range. None is easy, we think, usually, but indeterminate, the range is
Yes.
so large. You could be indeterminate the rest of your life and we think that's still a good
Yes.
outcome,
That's a
right? And some
possibility.
people-
Yes,
and
yes.
Yeah.
I think
Possibility.
that's a good question that
Right.
you asked. Maybe
Hmm?
we should clarify there has to be complete reepithelialization. If you see any scab or any eschar, then they come under indeterminate.
indeterminate.
A lot of our patients are undeterminate and we think they're
Better.
doing well.
Oh, yes.
So
Oh, it's an
never
improvement.
been-
Oh, yeah.
So
The
Okay.
problem with the regulatory agencies is there's no data out there to suggest what happens to those indeterminate ulcers in our discussion with them. So you have an indeterminate ulcer, there's no cohort data to say what happens to those indeterminate. Do they go back?
Right,
Or do they go to
If a 10
healing?
becomes a 3, does it eventually become a 0? Does a 3 go up to 7 in lots of people? We don't know, right?
Okay,
People
so Sora, we're
don't know
gonna
the
move on a little
developments.
faster, we're
Yeah.
taking longer than we think. So
Yeah.
this one, if there's a little bit of de-epithelialization here, we agree this is an active ulcer probably, right?
But otherwise.
Well, we agree with the concept, yeah,
With the
I mean, what it is.
concept,
So.
okay.
Yeah.
So the summary is what might some people consider an active ulcer but isn't, all right? So fissures are not active ulcers, we all agree with that, not ulcers, period.
So
They're
no-
not
there are
ulcers.
no
Not ulcers, we should change this to consider it an ulcer. An ulcer over a calcium deposit. We all agree that that should not be considered an ulcer for the
But it
purpose
is
of
an
these
ulcer,
studies.
but for a
For
study,
the purpose of the
it's not.
studies.
If you had
Well,
something
how do you
that
know
helped,
this calcium
heal.
deposit?
So how do you know?
Yeah.
So if you, so how do you know? I think that either you see the calcium,
Yeah.
or if you suspect calcium, you should obtain an X-ray. If you don't suspect it at all, should you obtain X-rays on every single person
No.
for every single ulcer? I think we would agree no.
Correct.
But I think it's up to the physician. If you suspect calcium in that area, do the X-ray and then make your own
And
decision.
they've
So-
told you that they've had this pellet come out of it.
That's right, a little pellet
Right, the
coming out,
pellet
that's
or
right.
oozing toothpaste.
So again,
that's pretty
for
obvious.
definition, that's an ulcer.
It is an ulcer.
And for
it's just
definition,
not
that's an
included.
active ulcer because there's de-epithelialization,
Right.
but that's an
But it's
exclusion
excluded.
criteria.
From the
Right,
study.
right.
Right,
But
okay.
it indeed is an ulcer.
Okay, we've decided that gangrene of the fingertip is not an ulcer. More or less, an ulcer that encircles almost the whole finger, usually the fingertip, is the same as the gangrenous ulcer.
Sort
Gangrene.
of superficial
You can get a non.
What do you
some
mean?
people will get.
Here?
That is a
What do you
big
mean?
ulcer.
Ulcers, like the one,
Oh,
like
the
the picture we
whole-
showed there.
Yeah.
I don't know if that was really, gangrene to me is black. That picture wasn't so black, so I wasn't sure to call it gangrene, but I would have excluded that one, okay? Painless ulcer I had here before, but in fact, we've taken pain out of the equation.
Yeah.
So an active ulcer could be painless, because we're not, you
No.
know?
Well, it could be a separate.
Well, what do you mean no? You don't ask
I
him.
think his point is
You don't
that
know.
you have an inclusion criteria,
Right.
for, at least for entry in study, that requires.
No, but as the study goes on, you're looking for prevention of ulcers, for example. If a new lesion appears that is painless, but you think it's an ulcer by looking at it, it's an
Still
ulcer.
Can an ischemic ulcer be painless?
Personally, I think 95% of them are painful, okay? But if we're not gonna ask about pain, then
Well,
painless
pain can
ulcers
be
are
a
meaningless
secondary-
concept.
Separate inclusion criteria.
Or
And
just
as a
another
second outcome
or
measure.
Well,
whatever.
but he's talking about a study where people don't have ulcers up front and you want to see how many develop ulcers. Or,
Yes.
or
Yes.
the prevention and
Yes.
somebody
Yeah.
has the ulcer and have underlying calcinosis, and they come with de-epithelialization now. And it's
No,
painless.
but that's excluded from the study. Calcium is not counted in that
Well,
study.
But that
but you
still
don't know
is an
there's
ulcer.
calcinosis.
Oh, so you measure, you look for calcium,
Yeah.
but there's no calcium, but it's not painful. It's an ulcer, but it's not painful. You're going to have to count that. If we're not asking about pain, you've got to count that as an ulcer.
Yes.
But it is an ulcer, because some people will say, because my hands are so tight, I don't even notice this. But if I had it, maybe I'd notice it, 'cause my hands
Okay.
are like, you know, so sometimes
Okay.
they say, my pain's 4 out of 10, and I just
Okay.
came and it's still 4 out of 10.
So basically, we're
Right.
striking that line that says
So,
painless ulcer.
yes.
All right. Indeterminate ulcer at baseline, we talked about that already, I think.
Well,
Okay,
that
so
would get
it's an ulcer,
indeterminate.
but it might be indeterminate.
Yeah.
Okay, so indeterminate, we've decided that cannot judge is our definition.